You done one like that? All right. Today we are going to discuss the topic of hidden brain injuries after a crash or fall. What every New Yorker should know. Welcome to another informative segment of Live with Mitch from the law firm of Proner and Proner. I'm your host, Mel Maguyo. And we sit down with the expert himself, Mr. Mitch Proner, a personal injury attorney with over 30 years of experience, here to answer your questions or any interesting topics that you might find useful in the personal injury world. And just as a reminder, folks, if you need to contact us, all consultations are free and confidential. Call us at any time at 1-800-321-1234. So how are you doing, Mitch?
I'm doing great. It's interesting. So as you know, but our viewers might not know, a lot of times I'm jammed up doing one thing or another, practicing law, representing our clients,
Right.
and I trust you to come up with new and interesting ideas for topics. And it just so happened that you presented with me with this just a little time ago about the brain injuries, and I happen to be preparing a case for a brain injury trial, and
Perfect.
it's an interesting case.
Okay.
It's a case where we've already turned down a uh, a large $1 million offer
All right.
because it's worth a lot more than they're putting on the table. And of course, it's a high stakes uh, proposal because a jury could do anything. A jury could reject my client's claims. The other side traditionally has doctors that refute my doctors. That happens on every case. No matter what injuries we have, no matter what proof we have, the other side presents doctors that say this is all nonsense. Insurance carriers hire lawyers, and these lawyers, they contest legitimate claims, and they have a right to legally.
Right.
We say this claim is legitimate. They have the right to say, no, it's not legitimate. We will look for experts that will say it's not legitimate, and we'll see if we get a jury to believe it's not legitimate. And the experts go in the hot seat. I cross-examine their experts. They cross-examine my experts. To be honest, I haven't lost a brain injury case, but that's not to say this next trial, I can't lose. Any case I try, I'm always scared of losing, because for me, it's not just another case, because I have a client, and at the end of the trial, I have to look my client in the eye, and hopefully they're thanking me and hugging me.
Right.
And I worry that if it doesn't turn out right, that I'm going to have to say to them, I'm sorry, I didn't do a good enough job for you. And so I always leave it up to the client. If they want to take the offer on the table, the case is settled.
Right.
If I recommend the settlement and they say, no, I want to go to trial, I'll try the case. I leave it up to the client. But let's get into today's theme.
Yeah, yeah. Yeah, so when someone suffers a head injury, whether it's a crash or fall, what makes a traumatic brain injury case so different under New York personal injury law?
Well, it's first of all, it's not just under New York personal injury law.
Okay.
It's under medical care. So I'll give you a for instance.
Okay.
It was a case I actually tried in the aftermath of 9/11.
Oh, wow.
It was in Manhattan, downtown. And as we were trying the case, you could literally smell the buildings were still burning.
Yeah, I
Because
remember.
after 9/11, when the Twin Towers collapsed, in the air downtown, there was a smell of burning electrical smell. It was really pervasive for quite some time.
Yeah, I
And the
remember.
case went for trial. And the judge who I tried it in front of said to me, Mitchell, what are you doing trying this case now? Nobody's going to care about your client with everything that went on. And I said, I got to get compensation. and fortunately, I was successful. But here's the way the case went. A woman was a couture milliner, which I didn't know what that was at the time. I doubt you do. You ever go to milliners?
It works on hats.
Yeah, very good. You're good. Okay.
I should know.
She was a couture milliner. She was a custom hat maker for high-end fashion. And she was in her kitchen cleaning some coffee cups or teacups, and the cabinets fell off the wall, hitting her in the head, knocking her to the ground. She went to the hospital because she took quite a hit to the head and she thought she should get checked out. And they said to her, did you lose consciousness? And she said, I don't know. I don't think so. But her neck was hurting, and she started treating with a chiropractor.
Okay.
And she went for chiropractic treatment, and she went back to work, and she noticed that the client comes into her shop and says, is my hat ready? And she says to the client, I'll tell you when it's ready. And the client says, well, you said it was going to be ready on such and such a date. And she said, normally when you tell somebody something and they say you said this, you remember and you say, oh, yes, of course, I spaced it. I'm so sorry. And you remember the conversation when you're reminded. She said for her, she had no memory. And then she went to, she got a phone call from a friend. And a friend says, where are you? And she says, what do you mean? She says, I'm in Central Park. We were supposed to meet to go for a walk together. And she was like, I didn't tell you we were going to go for a walk. And the friend says, yes, you did. We had this conversation. And wasn't that she remembered, oh, yeah, I spaced the meeting. I'm sorry. I forgot all about it. No memory. So she realized something was wrong. And she ended up getting treated at the day treatment center for brain injury at Rusk by a Dr. Yehuda Ben Yeshe, who I'll always remember. He's no longer alive, but he was a great expert. He set up brain injury treatment programs all over the world. Because, when you're a top doctor at a New York teaching hospital, they ask you to do that. And he said, he was my expert on the case. He was a treating physician. And I asked him if he would testify, and he said, yes, I would. It was sometime after she started getting all these brain problems that an attorney that she had in Westchester had referred the case to me for trial. And so I met with her treating physician. I'd never known him before. And he said to me, think of an aluminum can. He says, if it's crushed, and then you try to pull it apart so that it goes back to the way it originally was, he says, you could get the shape back, but it's never going to look like it did before it was crushed.
Right.
He says, that's what the brain is like. He says, it has healing, recuperative properties, but it never goes back to the way it was before. And you could do testing, and that testing will reveal what might be subtle or might be profound changes. Now, some people will take an impact to the head or a concussion and show no symptoms. Other people will show symptoms for a few days or a couple of weeks and then be better. Others might show symptoms for a few months and they could be better. And others never get better. It has to do with neuroplasticity, or the ability of the brain to heal itself. And not everybody's the same, and not every injury is the same. And there's a type of injury where the head moves rapidly, where they call a coup contra coup injury, where the axons inside the brain, the neurotransmitters, could be sheared.
Oh, wow.
and there can be profound changes. So I have another client, memory problems. Walked into a vestibule, which is the area sometimes when you enter into a building from the first door and the second door, there's like a
Right.
double doors and there's a little space. Sometimes a bank will have that. This was actually a bank. It was a Citibank, and they had a vestibule, and they just put the doors in, the glass doors, and there were no stickers on it yet. So he walks in and he bangs his head. And he was a high-end designer. And he said every year he would go to Paris for Fashion Week. And he would come back and he would tell his people, this is what I saw. I saw these designs. He would start drawing and get his people working and get everybody going. He goes to Fashion Week for a week after hitting his head. And he comes back. And they said, what did you see? And he had no memory of it. It was like a drunk blackout, except he hadn't been drinking. He had no substances. It was just a hit to his head. So at a hospital, like the first client that I mentioned, you go into a hospital, you hit your head, did you lose consciousness? I don't know. People are often not very good historians on whether or not they hit their head, they lost consciousness. But they'll do a test. They'll check the movement of your eyes, if you're lucky. If not, they'll just send you home. There's a thing that you'll see on an emergency room record. It'll say AOX3, and that stands for alert and oriented times 3. Now, alert and oriented times 3. Oriented times 3 means who are you? Where are you? And when is it? So I'm Mitchell Proner. I'm in my office. And it's October. I'm alert and oriented times 3. That's
Okay.
it. That's it. That might be the only test you get.
Wow.
Whereas other times people might have profound changes. I once went to a hospital and this woman was hospitalized and she was cursing like a sailor, dropping the F-bomb and I said to the husband, is she always like this? And the husband says, no, I've never seen this woman before. I mean, this is not this. She looks like my wife, but she doesn't sound anything like my wife. And this woman was like a volunteer at the Salvation Army. And she was just angry and cursing. And they kept her there. I took the case. 6 months later, she was this nice, delicate flower. Didn't remember anything about the hospital.
Oh, wow.
She didn't remember meeting me. She was fine.
Okay.
She had recovered. So sometimes people don't show symptoms, and then they have profound symptoms that last. Other times, they do show symptoms,
Right.
and they disappear. They get better. The case that I'm trying now involves a guy. He had a workplace injury, and he actually was impaled
Oh my
by
gosh.
a piece of metal that had gone into his arm. And they removed it, or they thought they did. But then a week later, he developed cellulitis, and they had to go back in, and they found out there was a foreign object in there that still had to be removed. And they were more concerned about his arm. and they thought maybe he broke his ribs or questionable broken ribs, and they were dealing with his orthopedic injuries. And you could see he comes here complaining about neck and back and knee and the arm, and that was his main treatment. But then you start to see mention of he's got these ongoing headaches since the incident.
Oh, okay.
And then there's a severity for headache index, and on this index where they ask you questions, and he was in the above the severe for headaches. So this guy was plagued with headaches, and nobody was treating that, because for a brain injury, typically they just can't go in and do brain surgery and make it better. Medicine is not there yet. So like an orthopedist, your shoulder hurts, I'll go and I'll fix your shoulder up. It's not like that with the brain.
Yeah.
So since doctors aren't making money treating it, a lot of them don't pay attention to those symptoms. You get sent to an ortho, back surgeon, but unless you got a tumor, they're not sending you for a brain surgery. Or if there's a coagulation of blood, sometimes they'll do a craniotomy to remove part of your skull to relieve the pressure on the brain. These brain injuries are often referred to as TBI, or traumatic brain injury. And typically, they'll diagnose them early on. They used to say, and they still do at times, post-concussive syndrome. Now they call it mild TBI. And there'll be another name in 10 years they'll call it. But for the person that can't work because of it, calling it mild doesn't really help them. They're unable to focus, concentrate. They might have a hearing loss. They might have vision problems. They might have balance problems. And there are different types of therapy that can help. Of course, for vision, you could get glasses, sometimes help, sometimes they don't. For hearing, you get hearing aids. For balance, you get vestibular therapy. And all these things, like any therapy, might help, it might not. And now, they're usually they do an x-ray at the hospital, comes back negative. You didn't fracture your skull. Well, they might do an MRI, and the MRI might not show anything. But now there's a more sophisticated MRI.
Okay.
An MRI with DTI, which is diffuse tensor imaging.
Okay.
And doctors used to fight back and forth between experts as whether or not that's real. Well, now there's a process to show these DTI studies called EMICA, which has FDA approval, which means it's accepted in the medical community that it's real and it's accurate. And 2 years after a brain injury, it can show parts of the brain that were damaged and prove the trauma. And for a lot of my clients, that's really helpful to them. Not because it makes them better, but this diagnostic test that shows the damage lets them breathe, because they say, you see, I knew there was something.
Right.
The doctors, they said, oh, the tests are fine. I knew there was something. I knew it wasn't right. My head wasn't because as we're speaking here and we're thinking, that's our brains that are doing that. So it's the ability of the brain to recognize itself that it's injured. And when you recognize your brain isn't working the way it used to, and the doctors are telling you the tests are normal, well, now we got a new test, and that shows, well, there's damage there. And we've got the experts that can get that into evidence, and it can help to prove a claim and get people the type of compensation they deserve. Because otherwise, before that, it's like, yeah, he says his memory's no good, but that's easy to fake. You give a test and you say, I don't remember the answer. So how do we know he's not faking? Right? I'm going to give you a list of numbers. 5381. Okay. Mel,
Okay.
what's that list?
5381.
Now pretend you can't remember it. Mel, what's that list?
I can't pretend I still know it.
But that's why,
Yeah, I'd be lying.
it's easy for the defense doctors to say they're
Yeah.
faking it,
Yeah.
right?
Right.
But now we've got a sophisticated test that's actually an objective finding, and we've got FDA approval, and so we could send the clients for that, and they can
Yeah.
get studies done. And actually, I can't send them for that. The doctors have to write a prescription that it's warranted and needed based on accepted medical protocols. I'm not a doctor, and I never played one on TV, but I am a trial lawyer, and so brain injuries are challenging cases. But the most challenging part of a brain injury case is for the victim. It's living with the injuries and getting on with their lives. And
Right.
when they have those struggles, I try to get them fair compensation for that.
Right. You know, I did have a quick question because this DTI, the Amica technology is still relatively new. You're not going to find it in a lot of it, whether it be ER or hospitals. Is that correct?
That's true. That's true. Not every city has them.
Oh, wow. Okay.
Not every doctor knows about them.
Yeah.
As a matter of fact, most cities don't have them. Most doctors don't know about it. It was the same thing with MRIs when they first came out.
Okay.
So it used to be somebody went to a doctor, there was an x-ray. That was it. That was the only tool they had in their toolbox. And then in the late 80s, MRI started becoming more prevalent. And then it was like a big deal. Where is there an MRI facility? Where's there a magnet? Because that's what they had to do.
Right.
And doctors started to finance these magnets and then try and get them paid for by getting patients to come in. And doctors at first didn't even know how to read them. They had to learn how to read an MRI because all they've been looking at was x-rays. And nowadays, you can't find a kid that gets out of medical school that doesn't know what an MRI is. It
Right.
doesn't exist. It just doesn't exist. But that technology didn't exist in the 80s. When I first started practicing law in 1988, and then by 92, the judges became like doctors. You would go to court and the doctor would say, you got an impingement on the thecal sac and the spinal column. How many millimeters is the impingement? And you're like, geez, I gotta look at I don't even know. The doctor, because the judges started seeing every day, all of a sudden lawyers started to prove their neck and back injuries with MRIs. And then the insurance company started to get like doctors that would say, everybody's got herniated discs. If you examine 6 jurors, 5 of you have herniated discs. They don't mean anything. They don't hurt. Because once the lawyers had a tool to use to show the injuries, the insurance carriers needed to get doctors that would say that's not an injury. And more importantly than the money people get is their health. Forget about what money somebody's going to get from a case. Now doctors, before they do surgery on someone's knee, they want to do an MRI. You wouldn't get back surgery without an MRI. There's no way a back surgeon would say, listen, I don't know what's in there, but I'm going to go in. You're in pain. But before MRIs, that's what doctors were doing. There was another type of exam called a myelogram where they would inject a dye in there. And based on where the dye was, they would go in and maybe do a back surgery.
Wow.
But nobody's injecting dyes in there. You want to get back surgery, spinal surgery, knee surgery, shoulder surgery, the doctor's going to do an MRI. It's a better way to treat people. And so these new tools that come about in medicine, sure, the other side's going to contest their reliability, because it might cost them money once you could prove somebody was really hurt. But the fact of the matter is, more importantly, doctors have a tool to diagnose, which
Right.
is better.
Right.
You don't want a
Right.
doctor going and doing surgery in your back if they don't know what's in there. An MRI helps. These tools are good.
Right. So not only these tools good, obviously for documentation, but most importantly, like you always stress, is for your health.
Right. That's
Very
right.
good. Well, Mitch, we're looks like we're starting to run out of time. So I'm going to start to close it out now, if you don't mind. So yeah, folks, there you have it. You heard it from the expert himself, Mr. Mitch Proner. And that'll do it for now. And thank you for taking the time to tune in, whether it's on our podcast or video broadcast. We really do appreciate you taking the time. And always remember, you can call us 24/7 at 1-800-321-1234, where consultations are free and confidential. Also, if you have not done it yet, follow us on Instagram, TikTok, Facebook, and of course, YouTube. Like, share, and please, if you can, subscribe so you get the latest updates. Now, before we go, Mitch, and I know you have an exciting day today. I don't know if you want to mention that now, but do you have anything else you want to say?
Yeah. So a lot of times the people that know the most about a brain injury are the family members, loved ones, friends.
Right.
The victim themselves might not even realize that they're not the same. They're irritable, they're not sleeping, whatever it is. If you have a friend or a loved one that had a head injury and just seems a little bit off, make sure they get medical attention, because the appropriate therapies can make the difference between a brain injury that heals and a brain injury that's permanent. So that's really important. Thank you, Mel, for another program, and I hope everybody found the program informative. Thanks again. I think you're muted, Mel.